Hey, it's David here. In today's class, I want to chit chat with you guys a little bit about bloodborne pathogens. Seeing what's been going on in the news lately with the bird flu and other strains of flu, the coronavirus in Asia and now in the US, I have a PowerPoint that was put out by the OSHA Education and Training Center. So it's out there on the internet at OSHA.gov. You're welcome to it. They encourage you to use it and to share it. And so today I just thought I would teach you a little bit about bloodborne pathogens. All right, let's get started. So we call our government rules and regulations in the United States standards. So in the standards, all employees who could be reasonably anticipate that in the process of performing their daily duties, their work duties, fall under this standard. They're protected by this. Also, Good Samaritans, acts such as assisting a co-worker as a nosebleed, would not be considered an occupational exposure. So this is the standard. All employees who could reasonably anticipate as a result of performing their job duties to face contact with blood or other potentially infectious materials. So an example of that might be nurses, medical care facilities, EMTs. A good Samaritan might be if you and I work together and I have a nosebleed and you come over to help me, but it is not your designated job to fix my nosebleed. Workers that are at risk, physicians, doctors, nurses, of course, orderlies, housekeeping personnel. So a lot of companies don't have a lot of nurses on hand, a lot of medical personnel, but they have a lot of janitorial staff. And the janitorial staff is one of the highest groups at risk. Now, in the United States, a lot of our janitors, housekeepers are jobs that are taken by anybody that can get them. So their knowledge and education in the safety and health field may be lacking versus somebody who's a doctor, who's a nurse, who's a dentist. So this is why it's important from my perspective that we got to reach at the bottom first. We got to go to the lowest level employees in our facilities and teach them first and do the best job of teaching them and then move up from there. It's like building a house. You got to start with the foundation. And housekeepers and people like do those crappy jobs that nobody else wants to do here in the United States. Well, those are the building blocks of any good company. So we need to teach them and protect them first and foremost. All right, let's talk a little bit about how exposure occurs. So some of the most common ways is needle sticks, sharp containers, saliva, blood, coming in direct contact with those. Now, for housekeeping and maintenance and those personnel in your companies, needle sticks, what they find when they take out the trash every night or clean up messes, that's how their exposure is. And like I said, that core group of employees is the most at risk in most companies. So we have to train them, PPE, and we'll get into all of that. But you need to focus on realizing how much hazardous materials, blood, needles, drugs that can lead to exposure goes into your garbage. Exposure control plan. It identifies jobs and tasks where the occupational exposure to blood or other potentially infectious materials will occur. So In our plan, we need to describe engineering and work practice controls. The use of PPE. We have to provide training, medical surveillance. That means medical testing and follow-up. Hepatitis B vaccinations. The use of signs and labels. So you must have a written plan on how you're going to deal with this. It must be reviewed annually at least, or anytime there's any changes in it, in the policy, in the procedures. If you add on another 1,000 square foot and you have bathrooms again, you got to look at incorporating all of that into that. If you build a new laboratory, whatever it may be. One of the best ways to build any good health and safety plan is to get input from those on the front lines. So if I'm going to be starting from scratch, I'm going to be doing my homework, but I'm also going to be sitting down and talk to the janitors, the maintenance workers, the housekeepers, the nurses, everybody, and get input so that I can figure out where the roots of exposure is and how to best protect everybody. Universal precautions. So we have to treat all human blood or body fluids as infectious. So until we know different, which we can't tell unless we test, we have to go on the assumption that it's all infectious. Engineering controls and work practices. Besides PPE, this is one of the most important things that you can do for any and all of your employees. These are primary methods to use to control the transmission of different diseases. When occupational exposure remains after engineering and work practice controls, you must use PPE. So here's what we're going to do. We're going to try to engineer out the safety and health hazards related to bloodborne pathogens. So, and if we can't engineer out, which renders the process obsolete, the exposure obsolete, then what we're going to do is implement PPE, and of course, we must train on PPE. All right, so here's engineering controls. So basically what we're going to do is isolate and reduce the exposure to our employees. So one of the examples is sharps containers. Sharps containers is a plastic box that you basically put all infectious needles or slides or glassware, anything in it, and it keeps it safe and you can't touch it. Self-sheathing needles, safer medical devices like needleless systems, all kinds of good stuff out there on the market now, and the medical field is getting more and more every day. So, needleless medical or a needleless system is a device that does not use needles. So that's cool. Engineered sharps injury protections, non-needle sharps, a needle device used for withdrawing body fluids. So as you can see, if you're really into the medical field, there's a lot of things that they're doing now out there. Now, that keeps the medical personnel. But we're going to focus a little bit more on our hourly folks doing the work nobody else wants to do. Work practice controls. So these controls reduce the likelihood to exposure. All right. Here are some samples. Let's make sure we wash our hands. We wear our gloves. We double glove. We wear the appropriate gloves. I don't know how many companies I've been into or facilities when I've done training, and they're like, oh, yeah, our janitors, they all wear gloves. Well, great, let me see them. And I come to find that they're just wearing cheap latex gloves, but they don't protect them from anything. Those traditional latex gloves really aren't that good for anything. You can double glove, but especially for your housekeepers and janitors, your kitchen workers, all kinds of people who handle things day to day, you want to use something much better like nitrile gloves, which is a thicker material. It's a much stronger material. It's less porous than latex. Latex is actually porous. When it stretches, the molecules open up and little holes come through. So then, of course, one of the big things I had when I taught all these years, and I managed laboratories, was no food or drink or smoking in work areas. You gotta isolate that hand-mouth contact with infectious materials. So you separate those out. Work is work, break is break. PPE, which is personal protective equipment. So we got all kinds of specialized clothing for medical folks, right? So properly worn and clean, you need to know how to use those, what they're used for. So not every mask is designed for every situation, all right? So gloves, gowns, face shields, eye protection, mouthpieces are all types or examples of personal protective equipment, and there's many, many more. Housekeeping. Now, what we mean by housekeeping in this situation is the upkeep of our facility, not the workers, but the general cleanliness of everything overall. And that's always been one of my big rules in my laboratories. Look, at one point in time, our laboratory was brand new and spotless, so it better be brand new and spotless in 10 years. So we got to keep things up. So we want to develop a written schedule for cleaning and decon. And I did this in our laboratories. We had a deep cleaning and a decontamination process after every lab, and then, of course, every semester too. So you want to write it up. You want to know what type of surfaces to be cleaned, what materials to be there, what the exposures are, what tasks to be performed, and what PPE and what chemicals are going to be used to do those things. Work surfaces must be decontaminated with the appropriate disinfectant. Now, you can't just throw bleach on everything and say, oh, yeah, it's good. All right, bleach has its own health issues. So if you're working around a bunch of viruses and bacteria, then you want to use a viral side. So you kind of got to know what's in your area. There are some universal things that will handle bloodborne pathogens, which is fantastic for your housekeeping crews to use. Regulated waste. You must have a written plan about what do you do with any waste. So if you come across a bloodborne or a blood spill in a bathroom and you clean it up properly, well, how do you handle the disposal of that? You must have a plan for that. Laundry. If you have a facility that does a laundry service or a laundry service company, it's also very, very important on how we handle this. So handling contaminated laundry as little as possible. So we want to reduce our exposure. That's where engineering controls come in. Let's say if you're a laundry service company or a hotel, instead of having a bunch of workers take out the dirty laundry and throw it in the machines, maybe you get a lift. Everything goes in a basket that falls down or gets put in these baskets. It gets rolled over the machine. A lift takes the basket and dumps it into the laundry unit and washes it. Therefore, that person is not touching the soiled laundry. So that's something very, very important to use and to understand. Engineering controls to keep the employees away from the materials that are at risk. Hepatitis B requirements here in the United States. We also have the TB test that if you're going to go to work for any healthcare facility Any restaurant, you must get a TB test. So here's some of the key things. What are we going to do if we've been exposed? Let's say that we helped our coworker with his bloody nose. What do we need to do? One, we want to wash our area with soap and water. We want to flush the nose, mouth, skin, whatever has been affected, our hands, our eyes. Report the exposure, make sure it's documented. And then, of course, we want to double check with our own healthcare or the company healthcare professional. So, post-exposure follow-up. If I've been injected by a needle getting something out of the trash, we want to document everything, record the injury to that, obtain consent from those individuals, provide risk counseling in post-exposure protective treatment and disease. So we got to do all of these things to keep our workers safe. Biohazard warning labels. So they're required on containers of regulated waste. Refrigerators and freezers that contain biohazard materials such as blood samples have to be marked. And you can't mix that refrigerator with the one for your lunch. You can't be putting your sandwiches in that refrigerator. Training. I tell companies all the time, this is one of the most important things you ought to do to keep the government off your back. Training. So you have to provide it at no cost. It's free to your employees, period. That's the law. So you have to provide at the time of initial assignment to a job. So you can't train me on bloodborne pathogens if I'm the janitor 6 months after I come to work. You have to do it immediately upon my hire. Before you put me in the field, you got to teach me how to do my job safely. Additional training when it's needed, meaning if anything changes, anything happens, refreshers, all of course has to be done. So a lot of the training elements are going to contain the law, the modes of transmission, how do you get effective, injection, absorption through the skin, inhalation, assumption, eating it. So all of that's there. What is your control plan for your site? So if we have a bunch of housekeepers, they're going to be exposed probably in the bathrooms, right, or the break rooms, things of that nature. If you're doctors, you're going to be exposed dealing with your patients. If you work in a laboratory, you're going to be dealing with the exposure to the samples. How to recognize hazards, the use of engineering controls and work practices, and of course, as I've said before, if you can engineer out a hazard, then you can eliminate PPE and everything else that follows suit. So if there's no hazards, there's no need for all of this. Medical record keeping, here's the key. Medical record keeping can be a whole week-long course in itself. So the thing I'll touch on here is medical records must be maintained for the duration of the employment plus 30 years. So if I work for the college for 25 years, they got to keep my medical stuff if I was exposed to a bloodborne pathogen for an additional 30 years. Sharp's injury log. So you must keep an injury and illness log when dealing with bloodborne pathogens or sharp objects, needles, glass slides, broken stuff, whatever it may be. All right, in summary, this is just a really light, quick overview of bloodborne pathogens. I would encourage you to go to OSHA.gov. There's free videos and PowerPoints and hours of free educational material out there that you guys can use. you're welcome to use this PowerPoint. It's right off of their website. I've been using it for, gosh, many, many, many years. So the key is this. You have to protect your workers. Bottom line. All right, guys. Thanks for attending. I hope everybody's doing well. Just thought I'd take a couple minutes and share with you.